What if I told you that the biggest risk of surgery after 60 isn't always the condition you're trying to fix, but the surgery itself? Every year, millions of older adults undergo procedures believing they'll return to normal life within weeks. Many do. But others face complications they never expected. Not because the surgeon made a mistake, but because an aging body responds very differently to major surgery. Today, I'm going to reveal 5 common surgeries that deserve much more careful consideration after the age of 60, and the questions every patient should ask before saying yes. Before we continue, I'm Dr. Ethan Cole, Senior Health Physician with 15 years of experience. On this channel, I share practical, evidence-based health advice to help you make informed medical decisions. If you value honest health information that can make a real difference in your life, consider subscribing. Now, let's get started. For decades, people believed that if a doctor recommended surgery, it was automatically the best choice. While surgery remains one of medicine's greatest achievements, modern research has taught us something equally important. The right treatment depends on the individual, not just the diagnosis. As we grow older, our bodies don't recover the same way they did at 30 or even 50. Organs become less resilient. Healing slows. The immune system isn't as strong. Recovery often becomes the real challenge, not the operation itself. Think of it this way. Imagine driving 2 cars through the same rough mountain road. One is brand new. The other has been on the road for hundreds of thousands of miles. Even if both vehicles are well maintained, they won't handle the journey in exactly the same way. The human body works similarly. An older adult may appear healthy on the outside while quietly dealing with reduced heart reserve, slower kidney function, weaker lungs, or decreased muscle strength. These changes may not affect everyday life very much, but they can significantly influence how the body handles anesthesia, blood loss, inflammation, and weeks of recovery. One of the biggest misconceptions I hear is, if I survive the surgery, everything will be fine. But surviving an operation and recovering from it are 2 completely different things. Recovery may involve weeks of rehabilitation, temporary confusion, infections, blood clots, loss of independence, or complications that require additional procedures. This is why doctors today don't simply evaluate whether someone can undergo surgery. They also evaluate whether that person's body can successfully recover afterward. Another important concept is frailty. Frailty doesn't simply mean being old. It refers to reduced physical reserve. A person who is frail has less ability to cope with physical stress, including major surgery. 2 people can both be 75 years old, yet have completely different surgical risks. One may remain active, exercise daily, and recover surprisingly well. Another may struggle with walking, chronic illness, or weight loss, making even routine procedures much harder on the body. That's why chronological age alone never tells the whole story. Now let's look at the first surgery that deserves extra discussion. Surgery number 1, open heart surgery in frail older adults. Heart surgery has saved countless lives over the past several decades. Procedures such as bypass surgery can dramatically improve blood flow to the heart and relieve severe symptoms. For many patients, these operations remain the best option. However, major heart surgery is also one of the most demanding procedures the body can experience. During traditional open heart surgery, the chest is opened, the heart is temporarily stopped, and a heart-lung machine takes over circulation while surgeons perform the repair. Although this technique has been refined over many years, it still places enormous stress on nearly every organ in the body. For healthy older adults, recovery can be excellent. But for patients who already have diabetes, kidney disease, lung disease, or signs of frailty, the risks rise considerably. Complications may include stroke, kidney injury, prolonged ventilation, infections, irregular heart rhythms, or extended rehabilitation. In some cases, the surgery itself is technically successful, yet the recovery becomes far more difficult than expected. Fortunately, medicine has advanced. Certain heart conditions that once required open surgery can now be treated using minimally invasive catheter-based procedures. These approaches often avoid opening the chest entirely and may offer shorter recovery times for carefully selected patients. Of course, they're not appropriate for everyone. That's why one of the smartest questions you can ask your cardiologist or cardiac surgeon is, am I a candidate for a less invasive option? Sometimes the answer will be no, but sometimes that single question opens the door to a treatment that places far less stress on an aging body. Next, let's talk about a surgery that millions of older adults are offered every year for chronic back pain, and why the decision isn't always as straightforward as it seems. Surgery number 2, major spinal fusion for chronic back pain. If you're over 60, there's a good chance you've dealt with back pain at some point. It's one of the most common reasons older adults visit orthopedic specialists. And often, when months of discomfort continue, surgery enters the conversation. Now, let me be very clear. There are situations where spinal surgery is absolutely necessary. Severe nerve compression, spinal instability, or loss of bowel and bladder control are medical emergencies that often require immediate surgical treatment. But when surgery is recommended solely for long-standing degenerative back pain, the decision deserves careful thought. Complex spinal fusion procedures can require long operating times, significant blood loss, and lengthy rehabilitation. Recovery may take months, and in older adults with multiple health conditions, the risks become much higher. Research has shown that while some patients experience meaningful improvement, others report pain levels that are surprisingly similar to those who receive structured physical therapy, exercise programs, and non-surgical treatments. That's why surgery should never be viewed as the automatic first choice. Ask your specialist, have I truly exhausted every reasonable non-surgical option? Sometimes the answer is yes, but many patients discover there are treatments they haven't yet explored. Surgery number 3, major cancer operations. Few words create more fear than the word cancer. Naturally, many people believe the faster a tumor is removed, the better. In many situations, that's absolutely true. However, for older adults with serious medical conditions, the conversation becomes more complex. Some cancer operations are among the most demanding procedures performed in modern medicine. They may last several hours and require extensive recovery afterward. For a healthy individual, those risks may be worthwhile. But for someone with advanced heart disease, reduced kidney function, lung disease, or significant frailty, the operation itself may become the greatest challenge. Successful cancer treatment isn't simply about removing a tumor. It's about improving both survival and quality of life. That means patients should discuss every available treatment option, not only surgery, but also radiation therapy, targeted medications, immunotherapy, or in certain cases, careful monitoring. Every case is different. The important thing is making a decision based on your overall health, not fear alone. Surgery number 4, elective joint replacement. Hip and knee replacements have transformed millions of lives. I've seen patients who could barely walk regain their independence and return to activities they thought they'd lost forever. These surgeries remain some of the greatest success stories in orthopedic medicine. But timing matters. When an older adult has multiple chronic illnesses, such as diabetes, heart disease, obesity, or kidney disease, the chance of complications increases. Blood clots, pneumonia, infections, delayed wound, healing, and longer hospital stays all become more likely. This doesn't mean you should avoid joint replacement. Instead, it means preparing your body before surgery may be just as important as the operation itself. Improving blood sugar control, strengthening muscles through physical therapy, managing blood pressure, quitting smoking, and improving nutrition can dramatically improve recovery. Many hospitals now encourage what is known as prehabilitation, helping patients become stronger before surgery rather than waiting until afterward. If your operation isn't an emergency, ask your doctor, what can I do over the next few weeks to improve my chances of a successful recovery? That simple conversation could make an enormous difference. If there's one message I hope you remember today, it's this. A surgical recommendation is not a final decision. It's the beginning of an informed discussion. Never feel uncomfortable asking questions. Never hesitate to request a second opinion. And never assume that one treatment fits every patient. Modern medicine offers more choices than ever before, and the best decision is the one that matches your health, your goals, and your quality of life. Before agreeing to any major procedure, ask yourself 4 important questions. What happens if I choose not to have surgery right now? Is there a less invasive alternative available? What will recovery realistically look like for someone with my health profile? And based on my age and medical condition, what are the actual risks I should expect? These questions won't delay good medical care. They'll help ensure you're making the best possible decision. I hope today's discussion has given you greater confidence the next time you or someone you love faces an important medical choice. If you found this information valuable, please leave a comment below and tell me which question you'd ask your surgeon before agreeing to an operation. I'd love to hear your thoughts. And if this video could help a friend or family member make a safer, more informed healthcare decision, please share it with them. I'm Dr. Ethan Cole, and I'll see you in the next video. Stay healthy, stay informed, and always be your own strongest advocate.